Jaringan Prihatin helps B40 household gain access to data plan or mobile device. AstraZeneca vaccinations to be expanded to other red zone states. Good evening. Thank you for joining us. You're watching News at 10. I'm Shuhaida Arifin. Prime Minister Tan Sri Muhyiddin Yassin today launched the Jaringan Prihatin program in an effort to bridge the digital gap of the B40 group. The program, involving an allocation of 3.5 billion ringgit, is expected to benefit approximately 8.5 million people from the B40 group who will be able to own smartphones or enjoy the broadband internet plan. From the total allocation, the government will provide 2 billion ringgit, while telecommunication companies and service providers will pitch in the remaining 1.5 billion ringgit, especially in terms of free data.
Untuk merapatkan jurang digital dalam kalangan masyarakat, terdapat keperluan untuk memastikan bahawa setiap orang mempunyai akses dengan kos yang berpatutan serta kemahiran yang diperlukan untuk memanfaatkan internet menjelang 2030. Lebih penting lagi, pembangunan kapasiti ataupun capacity building di bawah pelbagai program sektor awam dan swasta perlu disesuaikan dengan keadaan individu dan dengan mengambil kira pelbagaian latar belakang masyarakat. Maka dalam usaha kita untuk menangani krisis pandemik serta sekaligus untuk meletakkan batu asas ekonomi Malaysia ke arah yang lebih inklusif, mahu tidak mahu, jurang digital antara rakyat wajib dirapatkan.
In a related development, Tan Sri Muhyiddin also emphasised that Malaysia will remain committed to enhance connectivity in the country. The Premier explained that this is in line with the goal of 75% minimum connectivity level recommended by the United Nations UN, with broadband costs not exceeding 2% of the gross national income per capita by the year 2025.
Transformasi digital ini telah membuka ruang interaksi maya dan keterangkuman sosial yang lebih luas. Namun dalam masa yang sama, keadaan ini juga meningkatkan risiko ketidaksamaan bagi mereka yang tidak terhubung secara digital. Realitinya, masih ada dalam kalangan masyarakat yang tersisih dan ketinggalan daripada arus digitalisasi di negara kita. Peningkatan penggunaan internet telah menunjukkan bahawa sudah tiba masanya untuk capaian ataupun akses internet menjadi satu keperluan asas seperti air dan elektrik bagi segenap lapisan masyarakat.
The usage of internet worldwide has increased by 70%, with the usage of virtual collaboration tools surging by 600%. The same development and rising usage of these applications can be observed in Malaysia. Meanwhile, Finance Minister Tengku Datuk Seri Zafrul Tengku Abdul Aziz said the Jaringan Prihatin program launched today is part of the National Digital Inclusion Agenda aimed at alleviating the burden of 8.4 million Bantuan Prihatin Rakyat BPR recipients. He said this as the government is aware that there are many Malaysians who do not have comprehensive internet access in terms of availability and affordability, especially among the vulnerable and B40 groups.
Kerajaan Prihatin adalah kerajaan yang sentiasa mendengar dan proaktif dalam memahami keluhan rakyat. Untuk memastikan keluarga B40 yang mempunyai anak, terutamanya yang bersekolah, menerima manfaat daripada inisiatif Jaringan Prihatin, kerajaan telah menambah baik inisiatif ini dengan peruntukan tambahan sejumlah RM500 juta. Seperti yang telah diumumkan oleh Yang Amat Berhormat Perdana Menteri melalui program Pemerkasa pada bulan Mac yang lepas.
The Jaringan Prihatin program is a collaboration between the Ministry of Finance, the Ministry of Communications and Multimedia, as well as 12 telecommunication companies telcos in Malaysia. Based on the concept of inclusivity, he said the program is aimed at empowering Malaysians in the path heading towards a digital economy, ensuring that no one will be left behind. He added that telcos are also offering additional benefits worth 1.5 billion ringgit, bringing the total value to 3.5 billion ringgit for BPR recipients. Under the Jaringan Prihatin program, eligible recipients can opt for either a device package or a monthly data plan package. The government has established a Shared Prosperity Council (MTKB) intended to determine the policies and strategies for the implementation of the Shared Prosperity Vision (SPV) 2030. The Prime Minister's office in a statement explained that a key role of MTKB is setting targets, macro indicators and key performance indicators (KPIs) for key sectors for the development of the country, which will be formulated through an inclusive and comprehensive manner. Prime Minister Tan Sri Muhyiddin Yassin yesterday chaired the first MTKB meeting. According to the Premier, MTKB consists of 21 cabinet ministers, 4 department heads, 2 government-linked investment company GLIC heads, 3 representatives from the Malay, Chinese and Indian chambers of commerce, and leaders in the economic, education and social services sectors. Among those involved were Tan Sri Sulaiman Mahbub, Tan Sri Azman Mokhtar, Professor Dato Dr. Aini Idris, Dato Dr. Asma Ismail, Dato Dr. Madeline Burma and Professor Dato Dr. Denison Jayasuriya. Also formed was the Executive Committee for Shared Prosperity, JEKB, chaired by Minister at the Prime Minister's Department of Special Affairs, Dato' Sri Muhammad Rizwan Mat Yusof. Meanwhile, the Shared Prosperity Delivery Unit, SEPADU, under the Prime Minister's Department, will act as MTKB Secretariat. An unemployed man was charged by the Maran Magistrates Court for murdering his mother in Kampung Pesagi Chenor last Thursday. The accused, Muhammad Fairul Ahmadiyah, 39, however, made no plea after the charge was read before Magistrate Nur Syafiqah Nurda. The man was accused under Section 302 of the Penal Code for murdering his mother, Mariani Ismail, 55, at their house between 1:30 a.m. to 2:10 a.m. on 29th April. Deputy Public Prosecutor Anasuha Atikah Mat Saidi said the accused might be suffering from mental illness as he was allegedly been hallucinating during the incident. The court ordered the accused to be sent to Permai Hospital in Johor to undergo mental health screening before setting 2nd June for case remention. In the same court, the accused also pleaded guilty after he was charged for using methamphetamine on 29th April. The charge was framed under Section 15, Subsection 1, Subsection A of the Dangerous Acts 1952, which carries maximum fine of 5,000 ringgit or 2 years jail term if convicted. Coming up, Kuala Lumpur, districts in Johor, Perak, Terengganu under MCO from Friday. The AstraZeneca vaccinations would be expanded to other red zone states when over 1 million of its doses will arrive later this month. Coordinating Minister for National COVID-19 Immunisation Programme, Khairi Jamaluddin, said the COVID-19 Immunisation Task Force, CITF, would discuss with state governments to open up more AstraZeneca vaccination centres once the COVID-19 Vaccine Global Access COVAX facility furnishes more details on the vaccine delivery.
Rancangan sekarang ini sedang berjalan untuk memilih negeri-negeri yang sesuai untuk diberikan PPV-AZ secara program sukarela opt-in yang dijalankan seiring ataupun paralel dengan program imunisasi COVID-19 kebangsaan. From our experience, we turned around these PPVs in about 2 to 3 days only. So we are quite confident that dalam tempoh masa 48 hingga 72 jam kita dapat membuka PPV-AZ dengan cepat.
Meanwhile, on individuals who were in control trials for the AstraZeneca vaccine, Khairi said only fever side effects has been reported so far. The minister said this after his visit to the AstraZeneca vaccination centre at World Trade Center, Kuala Lumpur. Nearly 2,500 people have booked their appointments at the World Trade Center, KL. 2 other AstraZeneca vaccination centres at University Malaya UM and University Kebangsaan Malaysia UKM started operations today with 996 and 928 appointments respectively. Meanwhile, the minister said the reason why those who have registered for the AstraZeneca vaccine did not receive notice or appointments was because their identity card did not match the one registered via the MySejahtera application. Khairi said the Science, Technology and Innovation Ministry MOSTI would discuss the matter with the CITF to resolve the issue.
So when the ICs don't match, we cannot push the appointment because the IC for the AZ registration is different from MySejahtera. And in fact, a lot of people made typos on their ICs in MySejahtera.
However, Khairi said those who had entered their identity card number correctly but still did not receive an appointment notice could send an email to the ministry to resolve the issue. On another matter, Khairi said members of the media will be included in the second phase of National COVID-19 immunisation program later in May.
Untuk pengamal media akan kita mula masukkan dalam fasa 2 pada bulan ini. Ya? We are going through all the senior citizens now, but slowly we will put in some of the media. So saya sedang bincang dengan media outlets untuk bagi senarai-senarai wartawan. We can't get it all at once. We don't have enough, but maybe maybe we give a quota of a few to each media organisation first.
Previously, the government agreed to include media practitioners in the priority list of receiving COVID-19 vaccinations subject to supply. Now for the COVID-19 updates, the number of new cases in Malaysia remain high with 3,744 cases reported in the past 24 hours. According to a statement by Health Director General Tan Sri Dr. Nur Hisham Abdullah, of the new cases, 7 were imported cases while the remaining 3,737 were local transmissions. Selangor recorded the highest number of new infections in the country with 1,548 cases, followed by Kelantan with 480 cases and Sarawak 419 cases. Meanwhile, 2,304 cases recovered and were discharged yesterday, bringing the total number of recoveries up to 389,846, equivalent to a 91.86% recovery rate. Following this development, the number of active cases in Malaysia currently stands at 32,939. From the number, 328 of them are currently being treated in intensive care units ICU, with 185 requiring respiratory aid. The Health Ministry also reported a staggering number of 17 new COVID-19 related deaths in the last 24 hours, bringing the death toll in the country up to 1,591. He also said 20 new clusters were reported today, comprising 8 at workplaces, 6 in the community, 2 linked to religious events, and 4 in the education sector, including 3 educational institutions under the Education Ministry. The entirety of the Federal Territory of Kuala Lumpur will come under a Movement Control Order MCO from Friday until 20th May. Johor Bahru Kulai and Kota Tinggi in Johor will also be under MCO for the same period, as well as 14 sub-districts in Terengganu and 1 district in Perak. In a statement today, the Senior Minister for Security, Datuk Seri Ismail Sabri Yaakob, said the National Security Council decided this after examining the presentation and recommendation from the Health Ministry. The standard operating procedures announced for other areas under the MCO would apply. This includes the prohibition of inter-district and interstate travel except for emergency and work purposes. Food premises such as restaurants, food trucks, hawkers and kiosks are allowed to operate from 6 a.m. to midnight, catering only to takeaway and delivery orders. While grocers, convenience stores and fuel stations are allowed to operate from 6 a.m. until 10 p.m., except for fuel stations on highways that may open 24 hours daily. Daily markets, farmers markets, public and weekend markets can operate from 6 a.m. to 2 p.m., while hospitals, clinics and medical labs are allowed to operate as usual. Ramadan bazaars may also keep operating unless the local authorities decide otherwise. In the same development, all schools under the Ministry of Education in the Federal Territories of Kuala Lumpur and Putrajaya will be closed on 6th and 7th May. In a statement, the ministry said the decision to close the schools followed the decision to close all schools in Selangor on the same dates. It said the decision was made to reduce movement in the communities and interstate movement as the 2 federal territories are bordered by the many districts of Selangor. During the closure, the home-based teaching and learning (PDPR) approach will be implemented if suitable for both teachers and students. MOE, however, said boarding schools should retain the movement schedule for their students to return home for Aidilfitri so as to avoid confusion among the students, parents or their guardians. Ramadan Bazaar operation in all the 6 Selangor districts placed under MCO would no longer be allowed starting this Saturday. Selangor Menteri Besar Datuk Seri Amiruddin Syahri said for Aidilfitri bazaars and night markets, traders are allowed to operate during the MCO period until 10 p.m. but subject to strict conditions. He explained that the number of visitors at any one time is limited to 50% of the capacity according to the size of the premises, and the queue number system will be enforced, while children under the age of 12 are not allowed to enter these bazaars. He said that if there are violations of standard operating procedures (SOPs), the authorities would not hesitate to close the bazaar involved. Apart from that, Datuk Seri Amiruddin said dining in is not allowed from tomorrow at all eateries and hotels in the 6 MCO districts, including for Ramadan buffets, and that grocery stores, petrol stations and eateries could operate from 6 a.m. to midnight during the MCO period. He added that other details are subject to the National Security Council. In the meantime, Datuk Seri Amiruddin said the state government had also agreed to channel RM500 assistance to each affected Ramadan Bazaar trader following the order to close Ramadan bazaars to ease their burden. The Selangor Health Department JKNS will increase the capacity of critical care or intensive care unit ICU beds for COVID-19 patients in preparation for the possible sharp increase in COVID-19 cases in the state. Its Director Dr. Syahri Ngadiman said currently the usage of ICU beds in the hospital at the state has reached 92%.
Jadi bagi langkah tersebut, Negeri Selangor telah cuba untuk jabatan saya sedang sedia untuk meningkatkan kapasiti ICU yang sedia ada daripada 142 ICU sekarang kepada 200. Dan bagi memastikan kes-kes COVID ini kita tangani dengan baik, apa yang kita sedang buat adalah kita sedang menangguhkan kes-kes pembedahan elektif di seluruh negeri Selangor.
However, for non-COVID-19 cases that need to be treated immediately, JKNS will outsource to private facilities to ensure the ability to treat patients can continue. Speaking at a special interview with RTM and Bernama today, Dato Dr. Syahri said the current number of COVID-19 patients of Category 3 and above is currently higher in the state than in the previous situation. He said the current spike in COVID-19 cases was largely contributed by cases of close contact from family members of COVID-19 patients, which was 90%, while cases originating from schools and the industry sector each amounted to 5%. This shows that the community's non-compliance with the standard operating procedures is very unsatisfactory, adding that all parties need to play their respective roles in reducing the risk of infection. Desperate for oxygen, Indian hospitals go to court. That and more coming up in our foreign segment. Australian Armed Police today confirmed they had arrested 4 men in connection with the armed kidnapping of former Test bowler Stuart MacGill. The men were detained in a pre-dawn raid in Sydney following the kidnapping of the cricketer in the city's affluent Lower North Shore last month. MacGill was lauded as a talented bowler and played 44 tests for Australia, but was unlucky that his career coincided with that of Shane Warne, ranked by many as the best spin bowler of all time. Police said that on 14 April, the 50-year-old was confronted by 3 men at an intersection and bundled into a vehicle. He was driven to a property an hour out of the city and, according to the police, was assaulted and threatened with a firearm before being released after the hour-long ordeal. Local media reported that MacGill's kidnappers had been seeking a ransom. After extensive investigations, a police strike force and riot officers arrested 4 men aged 27, 29, 42 and 46 in the early hours of Wednesday. New South Wales Police said the men were then taken to local police stations where charges are expected to be laid. A court in India's capital, New Delhi, has become the last hope for many hospitals struggling to get oxygen for COVID-19 patients as supplies run dangerously short while government officials bicker over who is responsible. A 2-judge bench of the Delhi High Court has been holding almost daily video conferences to hear petitions from hospitals invoking India's constitutional right to protection of life. Lawyers say the court's intervention has saved lives. Last week, with barely a few hours of oxygen left for over 100 virus patients at Saroj Super Specialty Hospital and new supplies nowhere in sight, hospital authorities approached the Delhi court as a last resort for help. The judges ordered the Delhi state government to immediately arrange supplies. The shortage of medical oxygen has plagued the city of 20 million people for about 2 weeks, with unprecedented scenes of patients dying on hospital beds, in ambulances and in car parks outside, gasping for air. Representatives of Prime Minister Narendra Modi's government, which is managing supplies nationally, have told the court they were doing all that is possible and blamed the Delhi government, run by a rival party, for politicizing the issue. Saroj Hospital's trustee Pankaj Chawla said that instead of providing the much-needed relief to the critically ill patients, most of the hospital staff's energies are concentrated on ensuring oxygen supplies. Both governments, federal and that of Delhi, are facing criticism for not being adequately prepared for the surge in infections. National diver Pandalela Rinong splashed her way to the gold medal in the women's 10-meter platform at the FINA Diving World Cup 2022 today. Pandalela amassed 355.70 points to win the final at the Tokyo Aquatic Center in Japan. 137.35 points. Johor Darul Takzim JDT can thank their lucky stars for walking away with all 3 points after a last gasp penalty by Bergson Da Silva gave them a 1-0 win over Kedah Darul Aman FC KDA FC in their Super League top of the table clash at the Darul Aman Stadium in Alostar last night. Earlier, with both teams going toe-to-toe, home his 10th goal of the season when he sent KDAFC goalkeeper Muhammad Shahril Sa'ri, who was outstanding throughout the match, diving the wrong way. With the slim win, JDT continued to top the standings with 27 points to go 3 points ahead of second-placed Terengganu FC TFC. Second-placed Terengganu FC TFC were back to winning ways, overcoming UiTM FC 3-0 at the Sultan Mizan Zainal Abidin Stadium. The home win also sees Muhammad Nafuzi Muhammad Zain's men bounce back from the last week's 4-1 capitulation at the hands of Penang FC and reignite their challenge for the league title. TFC got off to a cracking start, going 2-0 up after just 10 minutes. David Da Silva gave the opener in the 8th minute before Muhammad Faisal Abdul struck 2 minutes later to give the Turtles a comfortable lead. Both sides continued to be aggressive in the second half, but it wasn't until Rahmat Makasuf who wrapped up the proceedings with the third goal in the 77th minute. That concludes this evening's news at 10. In our top story, Jaringan Prihatin helps B40 households gain access to data plan or mobile devices. Join us again at 12:30 tomorrow afternoon. I'm Shuhaida Arifin. Stay tuned to Saluran Berita RTM and have a pleasant evening.